A very nice video. This was a video celebrating the 40 years, and we'd like to thank the person who is responsible for that, Dimitris Tsodarousa, who created this video for free of charge, in a few hours' time. Thank you very much, Dimitris. So it's 40 years. We celebrate 40 years of our association. And in these 40 years, we have been able to change through our action the map of the disease in Greece in cooperation with our doctors and the state. And we are going to see what we've been able to manage. Before that, allow me to say a few words about our association. It consists of a board of directors. We are talking about volunteers, patients and carers and parents, and to the detriment of our personal time and without any remuneration, these people, these volunteers offer whatever they can. We have more than 1,000 members throughout Greece. We are talking about patients, parents, carers, relatives, friends, and we represent patients with cystic fibrosis throughout Greece. So we are in cooperation with the Scientific Committee of Cystic Fibrosis, our professional doctors specializing in the disease who provide us with their own advice. And of course, our association is a member and representing our country in European bodies, in CF Europe, in Eurordis, ELF, ERS, the ESOT, and of course members of other entities in Greece, the Rare Diseases Association in Greece, etc. The pillars of our actions, our priorities, support and empowerment of our community. We support our patients, their families, so that they can manage the disease and have better access to the provisions provided by the state. We try to strengthen and enhance specialized cystic fibrosis centers in order to have appropriate care for our patients. We try to improve access and timely access to medication and treatment. You've seen the fight we put up to have the gastro treatment brought in order for us to have it as soon as possible before it was even approved by the EMA. We support the actions for transplants. You know the actions. Before 2014, there was no access to transplants, and we had engaged into actions to have a cooperation with Austria. Then we had our own program, and you have heard about it and how well it's doing. Prevention is a very important part. We have raised the awareness of the public. We try to inform people who need to go through a prenatal test, timely diagnosis. Ms. Kanaka talked about it. We had neonatal screening in order for us to be able to see and diagnose cystic fibrosis patients, and through our campaigns we raise awareness, we inform the people that we are heard and people know about the disease. This is a picture we got the documents of the association, a very old picture with Mr. Adam on a gray shirt. Mr. Katsouliaris was the first then president, the late Mr. Katsouliaris. So in 1983, some parents, together with Mr. Adam, created the association. They took the courage, they undertook initiative, and they established this association that allows us to be here and speak today. Very briefly, I have some milestones, what the association has achieved throughout the years. Since 1984, every year we have an informative conference. It is an opportunity for all parents and patients to meet, to hear doctors and learn more about the advances. Imagine the past where there was no internet, no social media, etc. It was important. We would wait for the conference, usually in winter, to listen to Mr. Dodonakis, etc. We would wait to see where we would stand. Now things are better. We have the social media, the internet, and we're able to have information. To cut a long story short, in 1996 we started screening on cystic fibrosis. We informed the state because they didn't know what the cystic fibrosis was all about. And parents managed back then to acknowledge as cystic fibrosis is a chronic disease and have a reduced contribution in drugs. In 1997, we became adults. We would grow, and we had an adults section at the Sismanoglion with Mr. Iglesias, and in 2012 the adults decided that we needed to speak up. We decided that we should not hide and not be afraid of speaking. So we had the first campaign, the Each Breath. We had the first patients on the first interview, television interview, speaking about their daily lives, how they live, etc. And then we move on to 2014 with interstate agreement, where we had lung transplants in an organized way to save patients who had to travel to Vienna. 2020, this was a really important milestone because we brought the treatment 3 years ago. We were able to get the treatment, early access program, etc., thus saving lives of patients who were in very dire situation. And we also had the national registry for cystic fibrosis with many harsh and hard efforts. In 2021, there was the National Transplants Program initiation, and we started out our campaigns on transplants to raise awareness of the public to become organ donors. We had Lena at the Hospital of Nikia, and as of 2022, well, we established the psychosocial support program. Our teams that taken by Ms. Raketzi, the coffee breaks that we have on the internet providing support. We also prepared and established our site with a very analytical guide. Indeed, many have told us that the work that we have done, you see that there are all the government gazettes, etc. It took us months to do all this, but it's all there for you to see. And we continue throughout the years with the breath. Now, some of the actions, the programs that we had established for respiratory failure, conferences abroad, cooperation, mystikikilas, then with the drug, etc., that we wanted to reduce, the spirometers that we give our patients. Here are some more actions that have to do with raising awareness. Bicycle races, concerts, etc. Vivian and Vasilis, who is no longer with us. We always love them, and these patients would start speaking in order to help us make our disease well known. And we also have the support of many officials here, the President of the Hellenic Republic, who supports our campaign. Always by our side we have institutional bodies. And nowadays, cystic fibrosis is recognizable. They won't ask you what this is about. They'll tell you, okay, I've heard of that. They might not know exactly what it is, but they've heard about it. This did not happen overnight. It took years of efforts. Two more transparencies. Awards given to our association in 2016 regarding the campaign, the first campaign, Each Breath. And then we had in 2021 the awards for the mural that we had presented, the entire campaign for transplants. But we also got the Prix Gallian for Greece. We were awarded because we were able to bring the drug to Greece for early access. This year we have received the Bronze Healthcare Award, and we have a Humanizing Health Award. So it hasn't been announced yet, but only a few days ago I received it. We submitted a program whereby we are going to establish a helpline where patients or parents, etc., anyone now can call to get psychological support, and we let you know that this is a program that will be launched as well. So our objectives for the future, first and foremost, to empower the patients, our parents, to support them, the units for cystic fibrosis to be further developed, particularly for adults, because we have more and more adult patients, prevention and information and awareness of the public, what it is. It's about cystic fibrosis, and of course access to treatment, the A to Z. Without access to treatment, we can't do anything. Any innovative treatment will see to it that we'll get immediate and direct access, as well as access to transplants for those of you who need it, who I hope are very few. So this was my last transparency. 40 years from yesterday to date, a huge path, a huge journey. We remember back in 1983, and we focus on the present and on the future, because what we need to think about is that our past is our legacy. We should not forget it, and on the basis of our legacy, move on forward. And give you also another optimistic message. We adult patients, 42 years old with cystic fibrosis, I'd like to say that we heard so many interesting presentations, hopeful presentations, etc., even by Miss Anagnostou regarding pregnancy, etc. So our future is going to be even better. Those of you with small children have nothing to fear, indeed, because things will go better. The disease, well, my personal hope and wish is that, okay, it's a celebration of 40 years, and I hope that we will experience a moment where the association will no longer be needed. There will be no reason for its existence. So I think that this is the wish of all of us, to have a treatment that will put an end to cystic fibrosis.